Hi viewers of Lybrate, I am Dr. Vishwas here again to give you some insight on some common medical illnesses that we come across. Now you must have seen that on and off we get advised by our doctors to check our vitamin D and calcium levels, and obviously you must have seen that vitamin D has been found very low. It may be around 5 or 6 or maybe below 10, and that is of something which is very alarming. The normal level of vitamin D as a hormone which is to be maintained in blood has to be at least 30 international units, and those patients who are on long term low levels of vitamin D, they complain of many things like body ache, fatigability, low immunity, and then they suffer from some infections or some kind of all the time discomfort, weakness, lack of strength. So, we as doctors always recommend to get vitamin D levels checked at least once in a year. So, once we start with therapy of vitamin D, one should remember that the sachet or the tablet has to be taken early in the morning. It has to be empty stomach. The standard time should be 6 am to 8 am to take the dose, maybe weekly once or maybe weekly twice, not more than that, and the units normally recommended is 60,000 units, which is available in many brands. So, I would always recommend to my patients to take once in a week for 12 weeks period, which is sufficient. Then one should stop it, because over vitamin prescription as well as over vitamin consumption can damage your liver, and we have found sometimes patient landing into liver issues because of hypervitaminosis. So, both things are not good, very low levels and very high levels. You should maintain the optimum levels. Vitamin D as well as calcium, both hand in hand should go together as a supplement, and they build up your loss of bone, especially in cases of osteoporosis, where the bones have some kind of a vacuums inside and weaknesses which can make them easily fracturable and also cause some kind of a pain and discomfort. So, vitamin D, calcium, these are some kind of investigations which are especially essentially for bone health to take care. We also suggest sometimes to get parathyroid hormone checkup. Parathyroid hormone deficiency can also cause easy fractures, and this is very rare, but one should always check PTH, parathyroid hormone level, if it is recommended by your doctor, and if vitamin D correction is not helping the patient. So, early morning exposure during sunrise or evening exposure during sunset for 3 to 5 minutes, that is sufficient if it is exposed to your skin to get sufficient natural vitamin D synthesis in your body, because skin as well as kidney both play part in vitamin D formation, and it is one of the essential hormone required for all 206 bones of your body. With the new advent of vitamin D infused therapies, we have sachet, we have tablets, we have injections. So, depending upon the condition, your physician will recommend some or the other form of vitamin D. Even the young child also needs vitamin D supplementation. Nowadays, even milk is fortified with vitamin D, which is also a good step towards better health. So, I wish all my Lybrate users to have normal vitamin D, not only for them, but for all the family members, especially elderly ones, younger ones, so that they have excellent bone health and no fractures. Thank you viewers, have a nice day.